all kinds of cosmetic surgeries, but we've just heard about something that frankly took a lot of us by surprise. Millions of Asian women are making the startling decision to permanently alter the shape of their eyes through plastic surgery. What drives so many of these women to make this increasingly popular and controversial decision? Take a look as Alina Cho follows one woman through the process and right into the operating room to find out why and exactly how it's done.
Annie Cheng is 22 and beautiful. She doesn't think so yet.
Do you think you're pretty?
Not bad looking. I wouldn't say like really pretty because my standard is pretty should be having big eyes.
Annie's features are typically Asian. Her eyelids are very small, almost non-existent, and that makes her eyes look small. But all of that is about to change.
And that's very unique to Asians.
Soon she'll undergo surgery to make the folds or creases in her eyes bigger, to create what's known in the Asian community as double eyelids.
In general, I think double eyelids makes you look prettier and makes your eyes look bigger.
The man who will perform the surgery is Dr. Charles Lee. Lee is an expert in plastic surgery for Asians.
Well, this surgery is to Asians what breast augmentations are to mainland Americans.
To better understand it, we had Dr. Lee take a look at my face.
First of all, I guess, tell me how my features differ from Caucasian features.
The most common or most obvious thing is the upper eyelid.
Lee says my folds or eyelids are small.
And some Asians have larger folds, which if you open your eyes, might be set something like that. And this would be an Asian appearing, this would be an Asian with a larger fold than you have currently. Caucasians have a fold maybe way up here. What I would recommend for your eyes is bury some stitches and set your crease slightly higher, and then relax your brow now. Set your crease a little bit higher, so that your eyes look brighter.
By brighter, he means bigger, which is exactly what Annie wants. She wants to look a little like the Asian actresses she sees on TV and on the internet.
You notice the big eyes.
Yes, I actually really pay attention to that part because whenever I see a big eye woman, I just feel that, oh, she's really pretty.
Back at Dr. Lee's office, Annie is now getting prepped for surgery. First, she's sedated. Next, Dr. Lee measures her eyelids. The top line, 8 millimeters above her natural fold, is where Annie wants her new crease to be.
Okay, so I'm just making sure that the markings and everything are appropriate.
The surgery takes about 30 minutes. Basically, Dr. Lee is using stitches to force the skin to fold, creating a new, bigger eyelid, and in turn, a bigger eye.
When I get this stitch buried in there, you'll see that I'm just attaching the internal structures a little higher up.
Creating the crease.
Yes. When you finish this operation, she's still going to look Asian, and she'll be grateful that I kept her looking Asian.
Eyelid surgery was introduced in the 1950s after the Korean War, when women wanted to look more Caucasian to impress American GIs. Critics of the surgery say Asian women who alter their eyelids are turning their back on their ethnic identity. Dr. Lee says that's impossible.
No one's going to mistake them for being Caucasian or African American. They look Asian. So what we're trying to do is preserve ethnicity, and the bigger question is whether the standard of beauty is changing, but that's a little bit different a question than are you trying to change your race?
2 weeks after the surgery, we're back to see Annie again. The first thing we notice, besides her appearance, is that she's happy and confident. Her eyelids are clearly bigger, and with her new eyes, she's doing things she couldn't before, like experiment with makeup.
Right. But now you can see 2 colors. I can even put 3 colors if I want.
Though she feels sexier and more feminine, Annie says she's still the same person she was before the surgery.
I do still look Asian, but with the eyes now, the bigger eyes now, I just feel I look better. It's kind of like conceited to say that, but then I just feel that way.
So, Lena, there is such a great demand for this surgery. Do these women really feel some sort of societal pressure to do this?
Oh, they feel tremendous pressure, Paula. I
But
can
where's
tell
it
you.
coming from? Because on one hand, you hear the other people saying, don't give up that part of your identity, your cultural
Right.
identity.
Well, I think the media has a lot to do with it. This woman we profiled, Annie Cheng, said if it wasn't for the actresses she saw on television or the models she saw in magazines, she might not want the surgery. I can tell you, though, that Asian women with big eyes are considered, and this was historically true and now, considered the most beautiful. It's considered the most valuable physical trait you can have as an Asian woman.
All right, come clean. So are you tempted to go that route?
You know what? I was a little bit tempted, but my mother would kill me if she heard me saying this. But, you know, my family was very anti-plastic surgery, still is to this day. So I never felt the pressure growing up. But, you know, again, plastic surgery is an individual choice,
Sure.
and it is whether you're Asian or not.
Yeah, a very personal one at that. Alina, thanks so much. Very interesting.